Welcome to Nurse Stranger YouTube channel. Please subscribe this for more valuable videos. Today we discuss about primary health care. First of all, let me memorize the definition of health. According to WHO, health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Now just we look what are the factors influence to health. Our environment, culture, physical state, mental state, financial states, occupation. Okay. Now let we see the levels of health. Primary, secondary, tertiary. What is this primary health? It is the lowest level of health, but most important. Why? Because the majority of problems we can solve from this level. This is where an individual of the community meet a healthcare worker at first time or on first level. For example, rural maternal care units, then child units, school dental units, general practitioner, PHI, agriculture inspectors, likewise this. Okay, secondary level of healthcare is the first referral level. For example, peripheral units, basic hospital, likewise. Then territorial units that has been defined as highly specialized medical care, usually provided over an extended period of time. That involves advanced and complex diagnostic procedures and treatments performed by medical specialists. For example, general hospitals, teaching hospitals, national hospitals, likewise this. Then let's we go to our main topic, primary health care. Let me see some history of primary health care. You know, the international conference held in Alma-Ata, Kazakhstan from 6th to 12th of September 1978 has defined that primary health care. According to them, the definition of primary health care as follows. Listen, primary health care is the essential health care made universally accessible to individuals and acceptable to them through their full participation and at a cost the community and the country can afford. According to Alma-Ata, the principles of primary health care as follows. Accessibility, public participation, health promotion, appropriate skills and technology, intersectoral cooperations. Okay? There are 8 elements of primary health care like this: education, water and sanitation, nutrition, maternal and child health and family planning, immunization, prevention of endemic diseases, and treatment and drug availability, likewise this. On behalf of these 8 facts, it has divided to 17 facts in Sri Lanka. Like this, listen: health education, good nutrition, clean water, sanitary facilities, and good hygiene, maternal health, child health, family planning, immunization, prevention of common communicable diseases, prevention of common non-communicable diseases, care for the minor cases and training for the first med situation like first aid, CPR, rehabilitation, mental health, dental health, school health, vision health, occupational health, likewise. Okay. Now, let's go to our next subtopic, epidemics. Let me see some terms regarding this. Sporadic level. What's the meaning of sporadic? Sporadic means intermittent. Then this is the level of some communicable disease or some risk factors that affect to the health in negatively has spread in some areas as intermittent. Next one, endemic level. Endemic means only to some area. So it is a condition at persistent on minor or moderate level that only to some area. Next one, hyperendemic level. It also persistent but on a high level. Then epidemic. It is a condition that spread and meet more patients that we expected. Then what is pandemic? It is also like endemic but spread overseas like to other countries or to the other continents too. Then my next subtopic is immunization. First, it is a mechanism for protection of our body. When some pathological microorganisms or foreign body comes to our body, it can make a resistance to make sure about the protection of our body. This ability refers as immunity, and the system of the body for this ability refers as immunity system. It can be divided to two parts, innate or natural and acquired or adaptive. Innate or natural means innate immunity is the immunity that is present from birth. Then acquired, yes, acquired immunity is the immunity that is developed in an individual after exposure to a pathogen or through vaccination. There are innate immunity called as non-specific immunity. Acquired immunity called as specific immunity. What are the four elements of innate immunity? There are four types of defensive barriers. Anatomical barriers like skin and mucous membrane, physiological barriers like temperature, low pH and chemical mediators, endocytes and phagocytes, and inflammatory reactions. Acquired immunity is exposed to an infection or disease or vaccine or another person's antibodies. There are two types, active and passive. Active immunity occurs when our own immunity system is responsible for protecting us from a pathogen. But passive immunity occurs when we are protected from a pathogen by immunity gained from someone else. For example, active immunity through vaccination and passive immunity through placenta. Okay, now I am going to my last subtopic, immunization schedule in Sri Lanka. You know, on birth, before leaving from the hospital, that means within first 24 hours of the baby, we given BCG. BCG means Bacillus calmette guerin. Okay. Now, on completion of 2 months, OPV plus pentavalent plus FIPV. You know OPV? Yes, OPV means oral polio vaccination. FIPV means fractional intradermal polio vaccination. Pentavalent, yes, pentavalent means a combination of 3 vaccines for 5 diseases, that is DTP, hepatitis B and Hib. DTP means diphtheria, tetanus and pertussis. Hepatitis B, you know hepatitis B, and Hib for Haemophilus influenza type B. On completion of 4 months, OPV second dose and pentavalent second dose and FIPV second dose. Okay. On completion of 6 months, there are some variation. OPV third dose and pentavalent third dose. No FIPV. Okay, no. On completion at 9 months, you know MMR first dose. Yes, MMR, mumps, measles and rubella. On completion of 12 months, that means 1 year, after 1 year live JE. On completion of 18 months, OPV fourth dose and DTP. On completion of 3 years, that means in preschool age, MMR second dose. On completion of 5 years, OPV fifth dose plus DT 5 years fifth dose. On completion of 10 years, that means in grade 6, HPV first dose. HPV means, yes, human papilloma virus vaccine. After 6 months of first dose, HPV second dose. After completion of 11 years, that means in grade 7, ATD. ATD means adult tetanus diphtheria. 6 dose. Then females in the childbearing age, that means 15 to 44 years, MMR vaccine, that rubella contained vaccine to who have not been vaccinated with rubella contained vaccine earlier. For pregnant mothers, Yes, tetanus toxoid. First dose after 12 weeks of POA in first pregnancy and second dose after 6 to 8 weeks after the first dose. Then third dose in second pregnancy after 12 weeks and fourth dose in third pregnancy after 12 weeks. That's all my lessons on primary health care. This English medium video is specially prepared for my Tamil nursing friends. Please subscribe Nurse Stranger for further videos. Thank you.